To assess the extensor compartment of the wrist, we are going to have the patient's hand relaxed on the pillow. We are using a high-frequency linear probe. The first landmark to find for identifying where you are is the Lister's tubercle, and you can see the Lister's tubercle at the tip of the arrow. Now we are going to ulnar side of the tubercle. We see the extensor pollicis longus, and it sits on its little ulnar groove. We see the extensor carpi radialis longus and extensor carpi radialis brevis tendons at the radial side of the Lister's tubercle, and these are the second extensor compartment. After localizing the second extensor compartment, move the probe proximally. The first intersection syndrome is where the first extensor compartment moves over the top of the second extensor compartment, and that's called the proximal intersection syndrome. To examine the distal intersection syndrome, similarly place the ultrasound probe so its orientation marker facing the radial side of the wrist, and then find the Lister's tubercle. Then you will see that second extensor compartment on the radial side of the tubercle, and the third extensor compartment is found at the ulnar side of the tubercle. Then start to move the probe distally until you see the crossover of third extensor compartment over the second compartment. And if we move to the proximally, you see again the third compartment crossing over the second one.